When your thyroid gland doesn't make enough hormones to meet your body's needs, it's called hypothyroidism or underactive thyroid. If you still don't feel your best despite being on treatment, there could be a good reason why. So let's go to Olga to learn more about thyroid hormone therapy and new approaches to make treatment more successful.
Most common in women and affecting nearly 5% of Americans over the age of 12, hypothyroidism can affect critical body functions such as energy level and heart rate. Treatment for hypothyroidism involves replacing the hormone that your own thyroid can no longer make. I met with an endocrinologist who's going to provide more insight, but first, I'm going to tee off with Aza Muñoz, whose hypothyroidism not only affected her as a new mom, but as a professional golfer as well. Take a look.
Let's do it. Woo!
Okay, Aza, I mean, this is your full-time job. This is gorgeous.
Yeah, I've been a member here at Turtle Creek Golf Club for 6 years, and I absolutely love it.
It's beautiful. Tell me about your journey with golf and how it started.
So I started playing golf when I was 7, back home in Spain. My 2 best friends played golf, and I just went with them and loved it right away. So I remember coming home from school and just telling my dad, please take me to the golf course, and he did. So I've been in love ever since.
And look at you now, a pro golfer?
Yeah, this is my 14th year on the LPGA and European Golf Tour.
That's amazing. Congratulations there. Now, if you don't mind, tell me a little bit about your journey with hypothyroidism. When did it start?
So I got diagnosed in 2016. I think it started a bit before that, but there is when it got to the peak, I guess. So I've always been really tired, really cold, achy, but it got to the point that I would come home from practice and I just was exhausted. I could barely do it, and then I started losing a lot of hair. So I thought I was stressed from all the tournaments and traveling, because golf can be pretty stressful. So I went to the dermatologist just to hopefully get my hair back. And she knew right away, so she told me to do some blood work, and that's when I got diagnosed with Hashimoto's.
So how was your hypothyroidism treated after the diagnosis?
So I started on conventional thyroid medication from the beginning. So I would do blood work pretty regularly, every 1 to 2 months, and I kept getting normal thyroid levels, but my symptoms were still there.
So you're taking treatment and you still don't feel well. What did you have to do? What did the doctor do for you?
Yeah, so every time I went to the doctor saying that I was still not feeling great, I would just up the dosage. So I just kept doing that for a long time. But the symptoms never went away. So I just assumed that that's what it was going to be like. You know, I was going to have to be tired for the rest of my life.
So let's fast forward 5 years. You still are living a roller coaster, not feeling great. What was the turning point?
So I got pregnant with my son, and I remember thinking, how am I going to do all this practice, all these tournaments, and then actually come home and enjoy my son, you know, and that was it. I decided to go and see another doctor.
It's great to meet you, Dr. Ventura.
It's great to meet you as well, Olga. Thank you for having me.
Thanks for having us here as well. Doctor, why is it important for the thyroid to function normally, and what can be done when it doesn't?
Yes, so the thyroid, it plays a critical role in virtually every single organ in our body. When we have an underactive thyroid or hypothyroidism, we have a deficiency in the hormones that the thyroid make, which are the T3 and T4. And when that happens, then we have to replace it. And so in terms of treatment, monotherapy with T4, or what we call levothyroxine, has been the standard of care for over 50 years. And we have different formulations available that are branded or generic. I mean, they usually are tablets. There is a soft gel capsule, and most recently a liquid form. They all have the same active ingredient, which is levothyroxine, but they have different fillers or different inactive ingredients. In terms of other therapies, there are desiccated thyroid hormones, formulations that have these 2 hormones combined, which are the T3 and T4.
How do thyroid disorders affect a woman who is pregnant, or maybe a woman who just had a baby?
The thyroid function is critical. It's very important for our baby's brain and central nervous system development. And so during the first 3 months of pregnancy, our babies required 100% of our thyroid supplement to be able to develop properly. we have a normal functioning thyroid gland, the thyroid will adapt to this increased requirement. So there is definitely a 30 to 50% increase in thyroid hormone synthesis during this time.
What about a woman, let's say, that already has hypothyroidism, right? And she wants to get pregnant. Is there something that one does to prepare for that?
Because hypothyroidism has been linked to cognitive impairment and has been linked to an increased fetal death, you do want to make sure that your levels are optimized before you start considering getting pregnant.
So during that time period of pregnancy, does the mom need to be monitored more?
Yes, those levels should be monitored very frequently, every 4 to 6 weeks, when we do blood work, to make sure that the levels meet the requirements for a trimester-specific range. And then we increase the dose because up to 70% of patients that have hypothyroidism will require about 30% increase or more on their thyroid hormone supplementation. The American College of Obstetricians and Gynecologists actually recommend further screening if a TSH level is not actually high, but is outside of that trimester-specific range. And the American Thyroid Association actually recommends further testing, looking into an autoimmune thyroid dysfunction, because just by having that antibody positivity presents a higher chance of having any type of thyroid dysfunction during that postpartum period.
Dr. When Aza and I spoke, she told me that she was still having symptoms, and I thought that was interesting, despite being treated with thyroid hormone therapy. Why?
I usually see patients like her that come to the clinic and they have symptoms of hair loss, fatigue, dry skin, and often these patients have been diagnosed and they have been on medications. There's still 10 to 20% of the times where patients are treated with thyroid hormone and they're still having symptoms. And so whenever we treat hypothyroidism, it's very important to have consistent levels. There are some instances where medications or medical conditions can actually affect the way the medication is absorbed, and we end up adjusting the dose multiple times, and that might explain why patients feel good one month and the next month don't feel that good on the same medication.
Doctor, that's very interesting, and it's really important to create this awareness because a lot of patients don't know. So what are some of the specifics that can interfere with levothyroxine?
Yes, medical conditions, usually the ones that affect the gut, right? And so gastritis, reflux, celiac disease, any type of malabsorption syndrome, sometimes even the medications that are used to treat the reflux or the GI issues can interfere with the absorptions. And one that is very common is nutritional supplements, so calcium, iron.
Which is something that someone takes every day.
Absolutely, very important that you take your pill at different times when you take these medications. Even sometimes food can affect the way we absorb this.
And how would this affect the patient?
When you're taking the medication and you're not getting enough absorption, or the absorption varies, right? Your levels are always going to be off, and so you often will require multiple adjustments. And so even a small adjustment can make a big impact on your symptoms. And so we often see patients that have frequent adjustments, which is why it's so important that you have this open conversation with your physician so that you can identify what areas there might be an issue with.
Doctor, what about NDTs? A lot of people don't know about it, and I know it has the word natural in it.
Yeah, that's a really good question. And so NDTs, desiccated thyroid extracts, they're coming from porcine or pig thyroid glands. And so they're actually extracted, and though the source is natural, the way it's manufactured is not. They actually have additives, they have inactive ingredients, talc or sugars, and some of them are dyes. And sometimes patients do have allergies to this, and they can have GI symptoms or they can have a sensitivity to them.
Doctor, consistent levels of thyroid therapy are important. So my question is, how do NDTs impact that?
When we talk about treatment of hypothyroidism, we talk about monotherapy with T4 alone. And so we do that because we learned a long time ago that our body is able to actually convert T4 to T3, so we don't need it in most of the patients. And so when we talk about NDTs, we're talking about T3 and T4. Patients can have symptoms because they're having higher levels of T3s if the dose is not appropriately monitored. And so they can have palpitations, they can have insomnia, they can have multiple symptoms. And so especially in patients that have a cardiovascular history, in patients that are older, you have to be very careful with this.
So it's not your first line of therapy?
No.
Still to come, how Aza finally found the solution she needed to get back in full swing on
and off the course. We'll be right back. Welcome back. After trying to treat her symptoms using conventional thyroid hormone tablets, Aza still struggled to put the amount of energy into practice to keep her game at a high level. Aza, tell us about meeting Dr. Ventura.
Yeah, so I used to have a doctor back home, and I've been living in America now for a few years, and I was still not feeling good. I was just on conventional thyroid medication, so I heard about a really nice endocrine doctor here, and I came to visit her, and she's helped me a lot.
So when I met Aza and we talked all about her symptoms, her clinical history, and the fact that she still had some residual symptoms despite of normal thyroid function, which is something that we often hear. We talk about Tirosint SOL, and the fact is that I do prescribe a Tirosint solution for many of my patients who have still residual symptoms despite of normal thyroid function, and even patients that have a lot of fluctuating levels and have required multiple dose adjustments throughout time, or patients that have even have allergies to medications, and I'm concerned about an additive on the medication.
Doctor, what made Tirosint SOL a good choice for Aza?
Yeah, there are many reasons why I like it. There are plenty of studies that have shown that over time the concentration is very consistent, and so that's the key when you are treating patients with hypothyroidism. It is a liquid, so it's most likely to be absorbed a lot faster than tablet formulations. It is not affected by medications that can change the acidity of the stomach. It has only 3 ingredients, so it's less likely to have an issue with allergy or tolerance, etc.
Doctor, what are those 3 ingredients?
Yes, it's levothyroxine, it's water, and it's glycerol. So there is a less chance of having any type of allergies or issues with it.
Doctor, we spoke earlier about women who are pregnant. Mm-hmm. Is this also a good choice for them?
Yes, absolutely. It is a medication that it can be used in pregnant women and also women who are breastfeeding.
So Aza, what about you? What impact has Tirosint SOL had on you?
Well, the thing that I like the most when she prescribed it first, I really care what I put into my body. I'm quite healthy, I eat healthy, I exercise, and it's a medication that I'm gonna have to take for the rest of my life, and it's nice to know that I'm taking the purest option available. I've been feeling super great since I've been taking it.
Let me tell you, we were out on that golf course, and woo, keeping up with you, I mean, you are ready to win, you are ready to go.
Back to practice 6-7 hours a day, and when I come home, I have my son, so yes. I have full days, and it's really nice to not have to worry about not having energy, and I've been feeling great ever since.
And he's going to start walking soon and running, so are you ready for that?
I'm ready, yes.
Lots of energy.
Can't wait, yeah.
Great to hear. Any advice for our viewers, or maybe someone out there who's taking medication and still not feeling well?
Yeah, I think you should trust your gut. I think you should be feeling good. So if you are being treated for hypothyroidism and still feeling achy, still feeling tired, I think you should go see another doctor maybe. I'm so thankful I did, and thanks to Dr. Ventura, she prescribed Tirosint SOL, and I've been feeling great ever since.
That's so great to see that Aza is doing better and enjoying life again, thanks to Dr. Ventura and a different approach to treating hypothyroidism. For more information about Tirosint SOL, go to tirosintsol.com, or you can visit our website, thebalancingAct.com. Stay tuned for more important safety information.
Tirosint SOL levothyroxine sodium oral solution is not indicated for suppression of benign thyroid nodules and non-toxic diffuse goiter in iodine-sufficient patients. Tirosint SOL is not indicated for treatment of transient hypothyroidism during the recovery phase of subacute thyroiditis. Adverse reactions associated with Tirosint SOL are primarily those of hyperthyroidism due to therapeutic overdosage, including arrhythmias, myocardial infarction, dyspnea, muscle spasm, headache, nervousness, irritability, insomnia, tremors, muscle weakness, increased appetite, weight loss, diarrhea, head intolerance, menstrual irregularities, and skin rash. For full prescribing information, including boxed warning, visit www.tirosintsol.com.